Well, good morning, everyone.
Good morning.
We are going to be going over a few things. As Jill mentioned, we'll talk about the request for proposal and the decision that Logis made to move to Health Partners. A little bit about banding, that's new for 2017, overview of your plans, your two HRA and your HSA plans, and then a review of HRAs and HSAs. So starting with the RFP process. Now, we are recording, so that did get recorded. As an entity, the Logis Group is actually required to go out for bid because it is made up of municipalities. It is required to go out for bid every 5 years, and so we were up against the 5-year bid law. So that was one of the reasons why we were taking the group out for bid. But in addition to that, there was some other issues with healthcare reform that we were addressing. So we did take the group out in March, and the results that came back at the end of March, the committee took a look at it and based on rates and some other things, made the decision to move to Health Partners. As far as who were the finalists, Blue Cross was the finalist in addition to Health Partners. Now, Blue Cross is your incumbent, and so obviously we did take a look at Blue Cross. However, their rate decrease wasn't as significant as Health Partners. They came in at about a 3.7% rate decrease. Health Partners came in at an overall of 8.5% rate decrease. And there were some other things, again, that the committee took a look at. Now, Medica actually did not quote. They declined to quote, and their reason is that they actually don't participate in pooled business, so you won't see them with like service cooperatives or the state plan. Preferred One and PEAP is the state plan, Public Employees Insurance Program. They did not quote the pool also. They did quote individual groups, but they did not quote the pool. And we did take a look in this whole RFP process for the city as a standalone. So we not only looked at the pool and what would be the best choice to move, but we also looked at the individual cities within the pool. And a combination of the decrease that Health Partners gave and the bids that the city looked at as a standalone, it made really the best choice for them to stay within the pool and for the pool to move to Health Partners. So that's kind of the quick story on the RFP. But any questions on that, the process? Okay. Now, banding is going to be new starting in 17. Most of the groups within the Logis pool, now the City of Coon Rapids and a couple other ones have slightly different rates than the pool, but by and large, most groups within the pool all have the same rate, irregardless of their experience. So if their claims experience is better or worse, they really don't have a different rate. And what we wanted to do going forward was to actually give the benefit to those groups that happen to have better experience. So while there are some groups that have bad years and we want to limit the upside potential for those groups, we did want to give some reward to groups that are performing better. And so as you can see, City Coon Rapids happens to be one of them. You're actually running better than the overall pool. So if you look at Band C within the rating is that 8.5. That's the average for the whole pool. So the average being 8.5%, from that point, groups move up or down in 2.5% increments. Now you are running better than the pool, so you ended up in Band D, which is a 2.5% rate decrease from the average for the pool. The lowest is Band E, and that's a total of 5%. Now there were groups on the flip side that had higher claims experience, and they went up 2.5% all the way up to 5%, and that would have been Band A. So when we look at the overall renewal, or the decrease that we received from Health Partners, again, Band C being the whole pool got the 8.5%, but because the City Coon Rapids was in a lower rate band, in addition to the 8.5%, you got another 2.5% below that. So you actually ended up with 11% rate decrease. Now, going forward, each year, we're going to take a look at each individual group to see where you fall within the claims experience. Are you running better or worse than the average of the pool? The pool, however, has to remain cost neutral. So whatever the rate increase or decrease for the pool, that overall has to remain neutral. So in other words, if a group is moving up, another group has to move down. So it has to balance out. But for example, if we were to get the rate cap in 2018. Now, caps, as you know, are just that. They're caps on how high the increase can go. If the required increase is less than that, you get the lesser. But it's just a cap on the upside. But if we were to get, worst case scenario, the 9% cap for 2018, if you stay in the same rate band, band D, you're going to move up the 9%. If your experience improves, however, you might move back down. So instead of getting the 9%, you might move down another 2.5%. So instead of getting the 9, you get 6.5 instead. But it can also go the opposite direction. So that's kind of a plug for your wellness program, and hopefully you maintain a healthy workforce. But if your claims experience should spike and you should have worse experience, you could actually move up 2.5. So if that were the case, if the pool got 9% and you had to move up 2.5, you could actually get 11.5. So it goes both ways, depending on the experience for the group. But that's, again, that was the point of banding, is to benefit those groups that have better experience, but put a cap on those that actually have worse experience. So, questions on the banding? All right. Now, just quick review of your plans. One note, remember that Blueprint is going away. Blueprint is a product of Blue Cross. Allina Health System is still in the network if you're in the open access or perform, so Allina's still there. It's just that the Blueprint plan design itself is going away. Now you still have your 2500 HRA and you still have the 2600 HSA. That's not changing. And in fact, there's no real changes to those plans. You'll see when we go over that. You will have 3 networks, however, to choose from. Open access is the same as Aware, so no real difference there. If you're in Aware now, open access is going to be the equivalent, same doctors, same clinics, same hospitals. Perform is very similar to Accord. The difference being that Accord is minus Mayo and Hazelton. With Perform, it's minus Mayo. Hazelton is actually in the Perform network. But 2 other groups that are not in Perform is Sanford and Gunderson Lutheran, which really aren't in this area, so shouldn't really impact you. So essentially, if you're looking at open access, again, that's all the doctors and physicians, hospitals. Perform is the next step down. That's open access minus Mayo. And then the third option is going to be their Achieve network. That's a much smaller network, but it does include clinics like the Health Partners clinics, Park Nicollet, and some other clinics that are in the system. And Jamie's going to address that when she talks about her, how to find a doctor and so forth. If you look at it from a price perspective, open access is the most expensive, Perform is less expensive, and then Achieve is the least expensive of the 3 networks. Now your first plan option is the same. It's a $2,500 deductible per person, $5,000 per family. Both of your plans are embedded. Embedded means that if you have a family member that goes in for care, they are always limited to the single deductible, whichever plan you're on, and the single maximum out of pocket. Once an individual reaches that amount, they are then done for the rest of the calendar year and everything's paid at 100%. Other family members may still have expenses until all of you combined reach the maximum for the family. But again, embedded just means that one person will never have more than the single amount. Both of your plans likewise also have 100% coverage for preventative care, so keep that in mind. Now your HRA high deductible has still pharmacy coverage, so that is the min-max that we talk about. It's a 20% coinsurance where you pay 20% of the cost of the drug. The plan pays $80, but you have a minimum payment of $10 and a maximum payment of $25. If you happen to have a prescription that the total cost of the prescription is less than $10, you would pay the lesser. Now your HSA is a little bit different. Here you have the deductible, $2,600 per person, $5,200 per family. It's still embedded, you still have 100% coverage for preventative, still 100% after the deductible. The difference is going to be in the pharmacy. So with this plan, if you go in and get a prescription filled, you're going to pay the full cost of the prescription, subject to that deductible. So you're going to pay 100% of the cost of the prescription until you meet your deductible of $2,600, which is, again, also your out-of-pocket maximum, and then everything is covered at 100%. So you basically pay 100% up to $2,600, then everything is covered at 100% once you reach that amount. Questions on the two plans? Okay. All right, I'm just going to go over a review of HRAs and HSAs. Both plans are savings account. Whether you're in an HRA, which is funded by the city, or an HSA, which you can fund, anyone literally can fund your HSA, but both of them are trusts. Your HRA is funded using a VEBA trust. Your HSA is an individual custodial trust. Money goes in pre-tax, grows tax-free, comes out tax-free, provided it comes out for qualified expenses. Now, most people sign up for the HRA because they have coverage elsewhere. You'll see in a minute that's the problem with the HSA, is that coverage. HRAs don't have any requirement. You can have coverage through your spouse, you can be on Medicare, you can be in TRICARE, VA benefit, it doesn't matter. Full flexible spending accounts, your spouse can have full flexible spending account. Not a problem with an HRA. That's not true, however, for an HSA. The biggest deterrent for people signing up for and contributing to an HSA is that other coverage rule. So if you are covered through your spouse and your spouse's plan is not an HSA, that's other coverage, and that would make you ineligible to contribute to your HSA. Likewise, your spouse's flex. Don't forget about the flexible spending account. Both you here and your spouse have to have a limited dental and vision only flex in order for you to contribute to an HSA. So a lot of people think about the flex here, but they don't think about what their spouse signed up for. Make sure you keep that in mind, because you can get reimbursed out of your spouse's flex for your medical expenses. That's other coverage. So again, the biggest one's going to be the spouse coverage. Just make sure you're not covered through the spouse. But it's also going to include when you become 65 and you are now enrolled on Part A of Medicare. You can waive Part B, but you're still in Part A. Unless you actually go in and disenroll from Part A, that's other coverage. TRICARE. Now, VA benefits, they have clarified that a little bit. So if you are receiving care through the VA and it's for service-related illness or injuries, that's not other coverage. But if you're going to the VA for a cold or the flu, that's other coverage, and that would prohibit you from having any contributions to your HSA for 3 months. So it's new. That's some clarification. Now, flexible spending accounts and HRAs. If you have a balance in your HRA, or if you have a flexible spending account, if you want to contribute to your HSA, both of those have to be limited to dental and vision. That also includes MSRS. If for any of you who have healthcare savings plan, that's considered an HRA. So keep that in mind. If you come here from another organization, that could also apply. And I mentioned the flexible spending accounts. Again, your HRA, that $2,500 deductible, you can have a full flex, your spouse can have a full flex. It's only when you're contributing to the HSA that becomes an issue. Now, contributions for single coverage are going up, but not family. So if you are contributing to your HSA starting in 2017, it's going up $50 to $3,400. Family is staying the same at $6,750. And if you turn 55 in any time during the calendar year, then starting that year, you can add an additional $1,000, and you can add the additional $1,000 each year over and above whatever the maximum is for that year. Now, taking money out of the accounts, it's a little bit different. HRAs, obviously, you can take out for qualified expenses. It's for yourself, your spouse, and your qualified dependent. Now, there is, I do want to note, there is a current law in place under healthcare reform. We're waiting for some guidance, so this may change very well. But currently, the way the guidance states is that if your spouse and dependent is not enrolled in the city's plan here, starting next year, you cannot get reimbursed for their expenses. Okay? Now, we're waiting for some guidance that will say that as long as they're covered through a group plan, that it's okay, but as it stands right now, it's just there's two different laws within healthcare reform. One says one says another. Go figure. So we're waiting for clarification. If something comes out, you'll get an email from Jill. HSAs, taking money out, that doesn't apply. HSAs aren't considered health plans, so they're not subject to health care reform. So if you have an HSA, you can get reimbursed from your account for yourself, your spouse, and your tax dependent. Remember, now it's tax dependent, not just up to age 26. They don't have to be in your health plan. Okay? You can use your funds for any of that. And if you have qualified expenses, it's going to be tax-free, just like an HRA. However, an HRA, if you have an expense, you have a limited amount of time to get reimbursed for that expense. It's typically 12 months or the next calendar year. With an HSA, you can take out money anytime down the road. So you could actually have a qualified expense and wait 5, 10, 20 years to take the money out. When you take money out of an HSA, whether you request it through the website, use a debit card, however you take money out, as long as you've got enough receipts that equal what you took out, it's always going to be tax-free. But if you start taking money out of your HSA and you don't have enough medical, dental, and vision expenses for you, your spouse, and dependent, then the money's taxable. Okay. If you take money out prior to 65, you're also going to pay a 20% penalty for non-qualified expenses. But you can cash out. I mean, that's an advantage to it. If you take money out and it does end up being taxable, the best thing really to do is wait till you turn 65. Because then even if you take money out of your HSA and you've never had any qualified expenses and now you're having to pay tax on the money you take out, that's a deferred comp. Deferred comp simply means that you put money in pre-tax, it grew tax deferred, and then it was taxable when you eventually took it out. So an HSA, great if you've got qualified expenses, always going to be pre-tax. But even if you do end up taking it out down the road and you've never had any qualified expenses, it's still a good deal. Yep. MSRS? Yep.
Because you can't contribute to one or the other, or can't during that last year or something?
Yeah, the way that MSRS works is that if you are retiring at any time during the year, you're going to get a letter from them. MSRS is one that has your healthcare savings plan. And they will tell you that you cannot have contributions to an HSA at any point during that year to be eligible to take money out of your HSA, or to out of your healthcare savings plan, excuse me. So if you're going to retire any time in the year, according to them, you cannot. Now we actually disagree with that, but they're going to send you that letter and they're going to say they're not going to allow you to take any medical expenses out of that healthcare savings plan if you've had contributions that year with your HSA. So that's just, yep.
You just said you disagree with that?
Yes, our legal counsel disagrees with that.
Oh,
But
so there is some gray
Yes.
area or something?
yes,
Oh.
yes. But they're going to tell you that they run the program, so they're going to tell you that if you've had any contributions to your HSA that year, they will limit your healthcare savings plan to dental and vision that year.
So what if like you just said a retiree thing earlier, so if somebody were to retire in June, I suppose according to MSRS, you couldn't start taking money out of that healthcare savings plan until next January, but our retirees are still on HSAs and stuff, aren't they? So aren't they?
If you're on the high deductible health plan and you retire and you want to continue to make contributions to your HSA, you can certainly do that, and a lot of people do. They just sign that waiver form for MSRS. You just let it sit until at such time when you want to start taking money out of the healthcare savings plan through MSRS, then you would stop making contributions to your HSA. So yeah, especially pre-65 retirees, they're not on Medicare, you're not on Medicare, so it makes sense to contribute to your HSA. So in that case, you're just going to waive your eligibility under MSRS or limit it to dental or vision, and then just continue to make contributions to your HSA. But it's one or the other. If you're going to start taking out for medical reimbursements from your healthcare savings plan, you got to stop the contributions to HSA. Can't do both at the same time.
Just having the HSA itself?
You can have the HSA, you just can't make contributions to it. Yep, the key is contributions. So you can have your MSRS, you can be withdrawing from your MSRS, and you can be withdrawing from your HSA. That's fine, as long as you're not contributing to the HSA. The key word is contribute.
Right, and I hate to keep belaboring the point, but so, doesn't the city contribute on our behalf even if we don't put any extra money in there? Or is that not count?
The city contributes to the HSA?
Correct. For the
Okay.
retirees.
So then, as long as anyone is contributing to your HSA, you have to limit your MSRS. Doesn't matter who's putting the money into the HSA, it's one or the other. If you wanted to access your MSRS, the best thing for you to do is to switch back to the HRA. So, some retirees do that. They want to have that money in that MSRS to pay premiums or whatever they want that money for. If that's the case, if you want to access your healthcare savings plan through MSRS, you probably want to switch back to the 2,500 HRA, of which the city would still contribute. Yep.
I just got confused when you said that, I'm sorry. But the city is contributing for retirees to the HSA, that's right? Yes.
Either
That's right?
HSA and HRA to certain retirees.
Yes, certainly.
Certain retirees.
Those who have it in the police and fire contract. Police and fire.
Police and fire,
Yes.
okay. Not all employees.
No, just police and fire. And the other thing that's come up is for folks who are retiring at the end of the year, that final check that was coming January, to suspend HSA contributions for that check in January if they want to use the MSRS dollars
Good
that
point.
following year.
Yeah, because your last contribution actually comes out in the next plan year. So you want to make sure that it doesn't, so you don't have any contributions coming out in that year. Yep.
Would that
I know
be
it's
resolved-
confusing, there's too many plans.
Would that be resolved at some point? You just need to legal counsel disagree with that, or is that?
You know, that's up to MSRS. We don't really have anything to do with them.
My name is Jamie. I'm the account rep at Health Partners who will work with the city. And so I'm going to cover the transition period information and then some of the tools and resources available to you through Health Partners. So since Yvonne covered the plan designs, I will not cover those. If you have questions on that, just let me know. So to start with, we will have a member transition program in place. It's called Continuity of Care. What that means is if you are in the middle of treatment with a current provider that is not part of Health Partners Network, that treatment within the first 120 days, you'll be able to continue seeing that provider, and then we'll work to make sure we get you transitioned to an in-network provider at Health Partners. So it only applies to certain situations. So if you are in the second or third trimester of your pregnancy, you have a severe condition or illness, or you have a mental or physical disability that you have a specific provider for. Given your network options at Health Partners, it's fairly large, so the likelihood of somebody falling into this is pretty slim, but we do have it in place, and if anyone falls into that, we'll get them set up with one of our nurse navigators so that they can continue to get their care they need during the transition. And then the other piece, if you enroll in the HRA or HSA, that first medical claim that hits our system, you will likely get a phone call from Member Services, and they will give you a call to make sure you understand your plan design, how your deductible works, your out-of-pocket, and things like that. So similar to the medical transition program, there is a pharmacy transition program as well. And what that includes is the first fill of any non-preferred medication or non-covered formulary drug under Health Partners. That first fill in the first 90 days will process through without any issues. So you go to the pharmacy in January, February, or March, you fill your prescription, you're not going to notice any difference. You will then get a letter from Health Partners that's indicating you're taking a medication that is not on our preferred drug list, and it will give you information on either how to switch medications, or if it's a medication that requires a prior authorization or step therapy edits, how to get those documents in place. You still have coverage under your plan designs for non-preferred medications. It just likely will have a higher cost associated with it. Okay, so if you get a letter in the mail, don't be alarmed. Just check it out, see if you need to put any of those paperwork in place to continue getting that medication. And then this is for all new enrollees. It's not just at time of transition. So if somebody comes on the plan in April, they're going to have their own 3-month transition period as well. This is what your Health Partners ID card will look like. You will get this in the mail around mid-December, so watch for that to come in the mail. It will come in a fairly generic looking envelope, so do not throw it in the trash. Each person under your plan will get their own ID card. If you were a Health Partners member previously, you will have the same ID number, or if you are covered under the dental plan, your ID number will be the same as well. On the back of your card is just some phone lines for you, so our emergency after hours nurse line, member services phone line is on the back, and then if you ever need to make a manual claim submission, the information to do so is on the back of the card as well. Here's a sample of what your explanation of benefits will look like. So again, once your first medical claim hits our system, it will generate an explanation of benefits. That's going to be sent to your home, and it's going to include who received the service, what it was, where it was, and then how much money is going to be owed, if anything, on that. When you get your explanation of benefits, take a look at your clinic bill and make sure they match before you pay your clinic bill. You want to make sure your clinic bill reflects all of our discounts and different things that have been applied to that. And then these will come to you in the mail unless you opt into paperless. You can do that through our online account at healthpartners.com, and then all that information will be stored online for you and stored up for 7 years. So you can always go back and pull it if needed. Yvonne mentioned this as well, but all your preventive care under the plan with an in-network provider is covered at 100%, so regardless of what plan design. That includes all those annual exams, well-child visits, cancer screenings, immunizations, eye exams, that type of stuff will be provided under the plan at 100% with an in-network provider. So that's definitely something that gets overlooked, so make sure you're taking advantage of that and getting in for those annual exams. The next few slides is information on pharmacy. All this is in that blue booklet if you picked it up when you walked in. But our pharmacy list is called Preferred RX. Each carrier has their own drug list of preferred medications or formulary medications, but they don't always match. So if you have medications you're taking, you'll want to go out to the website and take a look to see how your drug specifically will be covered. When you're out there, you're going to see a key of information. So if your medication has an F next to it, it means it's a formulary medication, and that is covered under the Health Partners drug list. NF means it's non-formulary, so again, you still have coverage under your plan, but a higher cost. And then if it has an X next to it, it means it's an excluded medication and it is not going to be covered under your plan. Some other information when you're taking a look at that drug list, all the generic medication is going to be listed in lowercase italics. All brand medications and oral contraceptives will be listed in capital letters. And then anything that is a specialty medication, and those are very high cost drugs to treat cancer or MS or rheumatoid arthritis, those will be in blue and will have a blue pill next to it when you're taking a look at that. Also available out on our website before you need to be logged in with an account or anything like that is a drug cost calculator. So if you want to see how much your drugs will cost under the Health Partners plan, you can go out to that website and you can search for your medication, and you'll be able to see if you get that billed at CVS or Cub or Costco or Walgreens, what is your cost going to be to get that medication. So it's a good way to plan if you're looking at that HSA plan design. Couple other resources for pharmacy. You can meet with a pharmacist and work with them one-on-one. It's called medication therapy management. But sometimes if you are taking multiple medications, it's nice to sit down and go through them, make sure you're taking the right drug for your condition. Do they interact with each other, or do they interact with alcohol or food? Those types of questions. They're a great resource available to you for that. Information online with our health information library, and then we also have a mail order pharmacy program. So if you get monthly medications that you're filling on a maintenance basis, you can get a 90-day supply for 2 copays under that HRA plan sent to your home through the Health Partners mail order pharmacy. So very easy to make that transition. All you need to do is go online and it will walk you through steps to transition that medication over. Or if you're on the HSA plan, you can still get a 90-day supply. It'll likely have a lower per unit cost. And lastly, you can get a 90-day supply at retail, so at Walgreens or at Target, but you're going to pay 3 copays under the HRA plan or the cost of that medication again under that HSA plan. Any questions on how that works at all? So the next slide is information on Virtual. This is our online clinic, so very similar to a retail clinic like the Target clinic or CVS Minute Clinic. You go in for those common conditions that you know what it is, you just want to get your prescription and move on. So they can treat up to 60 common conditions. It's a Health Partners owned program staffed by a nurse practitioner of Health Partners. So good examples of what it can treat is sinus infection, pink eye, rashes, coughs, colds, those types of everyday things that happen. Go online to the website, it's just virtual.com, and you're going to walk through a series of questions. They're going to get that information, and then they will respond to you within 30 minutes with a treatment plan. If they come back and say, yep, you have a sinus infection, here's a prescription, where can I send it? They'll send it to a pharmacy of your choice, and it will have a maximum cost of $45 for that service. So exact same thing if you went to the Target pharmacy or the Target clinic or a CVS Minute Clinic, but at a much lower cost. It is covered at 100% on the HRA plan design as well for you. So it's a great option to start at because it is a much lower cost, and if they cannot treat you, it will kick you out and say, I'm sorry, you need to go into the doctor's office. So any questions on that? Or has anyone used it? Nice, good. All right, so with your plan design options you have here at the city, you may want to take a look and figure out if you are exactly on the plan that you need for your own personal situation. So we have an online plan comparison tool. It's called Plan For Me. You just go to the Health Partners website, it's healthpartners.com/plan4me, and it will walk you through your plan designs, who you're going to cover, what type of medical services you need typically in a year, what prescriptions you take, those types of things. And then it will show you side by side, based on the cost to the plan and your contributions, what is your best case scenario for premium and medical costs out of your pocket for what plan design you should be on. So especially with the different network options, take a look at this because you are able to pull up your doctors and things and find out which clinics your providers fall under for each network. So access information is in your booklet, but all you'll need is your group number. It's 13470. Your site will be all, and then effective date is just 1/1/17. Next few slides is just information on our phone line. So these are all in your blue booklet as well. But if you will have questions when you leave the meeting today on your benefits, your providers, procedures, that type of stuff, you can call member services. They're available Monday through Friday from 7 a.m. to 7 p.m. To answer any questions. They know you are coming on for 1/1/17. Just say you're with City of Coon Rapids and give them that group number. Careline is that after-hours nurse line. So again, if you are home in the middle of the night, or not feeling well, or trying to figure out if there's a home remedy, or if you need to go into the doctor's office or urgent care, you can call and speak to one of our nurses. They will be able to provide you with that medical advice. Nurse navigators we talked about there at the beginning for the transition, but they're also available for any complex medical situation. So maybe you have a new diagnosis, or you are looking to find a specialty doctor to see and you're not sure where to start. You can call them and they will be your health plan advocate. They will make sure you are getting care based on your own personal preferences and needs, or answer any questions between those doctor visits that you might have. Baby line is for new and expectant parents, and then the behavioral health line is to answer any questions on your behavioral health benefits or help make appointments with a behavioral health specialist. And then the last phone line is our pharmacy navigators. So they are very similar to the nurse navigators, but they are the pharmacy specialists to answer questions on your medications, help you find a lower cost option perhaps, or if there's a drug manufacturer coupon, they're a great resource to find that information for you. As a Health Partners member, just a reminder, you will get discounts at various retailers. So that includes exercise equipment. So if you go to Second Wind Exercise or Eric's Bike Shop or Penn Cycle, tell them you're a Health Partners member and they will tell you what discount you can get on your purchases. That also applies to some healthy mom and baby products. So baby proofing your home or a diaper service, some healthy eating options. So if you go to Let's Dish or Seattle Sutton's or Nutrisystem, same thing, tell them you're a Health Partners member and they will tell you what discount you will receive off of any of those services or your purchases on that. That also applies to our gym discount. So if you are going to the gym today 12 times or more per month, you will get that $20 reduction on your gym dues. And that will apply to any dependent on your plan, so you can receive up to 2 reimbursements per household per month. Make sure you give your gym your ID card when you get that in the mail for January so that they can start sending that information to Health Partners. Our list is fairly large. It includes Lifetime Fitness, LA Fitness, Experience Fitness, Anytime Snap, kind of the major gym systems and things. If your gym's not on that list, let us know and we are happy to reach out and try and contract with them for that. All right, so the next couple slides is just information on our website. So again, if you leave and you have questions on your provider and things, you can go to healthpartners.com. You'll be brought to this main page. If you are looking to figure out where your provider falls and what network, you're going to click on that tab that says insurance. That's going to open that drop down and you're going to click on find a doctor in my plan network. Don't click on doctors and clinics on the very far left because that will only take you to Health Partners providers and you will not be able to find Alina or Fairview and things in there. Once you click on that, you will bring to the next page. You're going to select I get insurance through work. And then that's going to open this drop down where you're able to search through one of those 3 networks. So under that open access network, which again has the largest network, it is the higher cost one, but it has coverage coast to coast. So if you're traveling outside of Minnesota, you're still going to have access to a provider that is going to be considered in-network because of our affiliation with the Cigna wrap. That emblem will be on your ID card as well, so other providers will be aware of that information. Open access for form, again, is same thing as open access minus mail, and then the Achieve network there at the bottom, again, is mainly health partners, providers, Park Nicollet, and then some individual clinic systems. And then same thing for your drug list. If you have medications you're taking and you want to see how those will be covered, you can just go to the Health Partners site, click on Pharmacy, view drug list, and then that will take you to the next page where you will click on the Preferred RX formulary. Once you click on that, the next page you'll be brought into, you can search for your medication, search alphabetically, type it in, or look it up by therapeutic class. And then the very last slide is just information again on the account. So once you have your ID card that you got in the mail, you can create an account at Health Partners. That'll be your personal account that will have what plan design you enrolled in. It will be specific to your network you enrolled in. And then all of your plan benefit information, claims information, that type of stuff is going to be out on our website. That also translates into our smartphone app. So if you have a smartphone, you can download our app and you'll have the same information, the same login on your phone, so you have it available as you're out and about. So search for doctors and clinics, view recent claims information. You're able to get your plan balances if you want to see where you're at with your deductible and your out-of-pocket for the year. Get cost estimates based on your plan design with our providers. And then you're also able to pull up your ID card. So if you don't happen to have your ID card in your wallet or your kids' ID cards in your wallet, you can pull it up on your phone and it will look the same as it is if it's in your hand, and you're able to fax it to your doctor or your pharmacy. So it's very handy. It's one less thing to have to carry with you in your wallet. And that's it.
You can list it. I know you covered it. You can go to that website to figure out what medications are covered, but is there one that says which pharmacies
are covered? So we cover majority of all the pharmacies in the state. You shouldn't have a problem with that, especially all the chains, but that is out on the site as well if you want to look up a pharmacy location.
Could you clarify the Cigna coverage? Is that only with open access or is it with all 3 networks?
So the Cigna coverage, which is that wrap where you have coverage coast to coast, is with all 3 networks. So we'll have coverage if you're traveling. Also, if you are out of the country, you will still have access to care as well, but you're going to have to pay at point of service. So if you're in Mexico and you break your arm, you're going to have to go get your services and things, pay for that, get it, all the information about what you received and what you paid, have it translated back here if need be, and then you'll submit that to Health Partners and we will reimburse you. All those claims will still process under the plan. If it's an emergency situation like breaking your arm or a heart attack, that's going to just process under the in-network benefit. So hopefully everyone's traveling somewhere and that doesn't happen, but it does sometimes.